Good morning, good afternoon, and good evening. Welcome to the 423rd continuous Zoom session of Ifph. Before we proceed, let us have a silent prayer for. This is the 423rd day of continuous Zoom session. So it's a tough act to arrange the seminar in this uninterrupted session. It's very, very difficult indeed, especially when the doctors or the participating fellows are engaged in very busy schedule. So that's why our dear friend Dr. Dhanesh Jayasimhan is once again back with the story of thyroid. Thyroid problems by Dr. Dhanesh is the topic. We are waiting for his arrival. The weather conditions in Kerala is raining heavily. That may be the reason. So let us wait for him. Meanwhile, we can have those who have participated in discussion, so can have something to say on thyroid disease. Can raise your hand, please. Well, the thyroid is an important organ which always leading the development of the child, especially the mental mechanism is very much in connection with thyroid, and I think it is very important to consider the involvement of thyroid in so many diseases, especially in case of children. They often develop constipation, severe constipation. We inquire the family history. Definitely, the parents might have some thyroid problems. So it starts from there. Unfortunately, majority are not at all bothering about that. The parents as well as even the physicians. But we can see that the involvement of thyroid problems in the family, have some thyroid disease in the family history. Then also some skin problems, exfoliation of skin from various parts of dryness of skin. Then the so many learning disabilities and problems. Well, all these are happening as a result of the thyroid problem. So, and if an intelligent physician is there, he can see all these things. If we not consider all these things, naturally the child will develop and with some difficulties in learning as well as in growing. At last, what happens? They approach a physician. He will naturally test the T3, T4, so many enzymes and hormones are there, and declare as hypothyroidism or hypothyroidism. Yes, I think our guest Dr. Dhanesh joined. Doctor, we can go proceed directly to the topic. Doctor, I have already said the opening note on this session. So welcome, Dr. Dhanesh. Please make Dr. Dhanesh as co-host. Yes, Dr. Dhanesh, I think you can start. We'll make him better, doctor. Please unmute yourself, Dr. Dhanesh. Yes. Now you are the co-host. Yes. Welcome, Dr. Dhanesh.
Good morning, good afternoon, and good evening to all participants from different parts of the world. As you all know, this is the 423rd webinar session, and I am very happy to be here with some more stories. As you all know, all of the doctors are in hectic activities for these COVID preventive measures taken by our government to school children, and most of the doctors have completed their work in a beautiful way. And let me congratulate all of you who has done wonderful work for the COVID preventive measures to the children, school children. And now let us have a session in a different way. Since most of the doctors are engaged in that way, we are not able to get a good faculties for this session. So as there is no one to take a charge today. I was forced to take this session once again. And anyway, since I was very busy day today, I couldn't coordinate all those things together in a good way. So if at all any problem arises, kindly wait for the same, and Dr. Manoj will assist me in all those circumstances, I hope. Okay, today, as you all know, that our subject is none other than thyroid diseases. As you know, the most of the young generation, as well as the people around this menopausal age, also suffering from this disease. But everybody thought that it is because of the iodine deficiency or something like that. But actually, that is not at all a truth. That it is only just another an etiology. Like actually, it is unknown etiology like that. They have to say. Then instead of saying that, they are specifically focusing on that particular iodine mechanism, and almost all people are taking iodine. But still, the rise of thyroid patients are more and more. As you know, I am belonging to a area that is a coastal area. We are just 3 to 5 kilometers away from the uh, uh, Arabian Sea. So you can understand the situation here. But naturally, there should not be any problem in that way. But unfortunately, most of the young generation people, as well as the others, are getting this thyroid diseases nowadays. The rise of number of thyroid diseases is something that we need to undertake a research work to see what are the reasons. But frankly, from the history, as you know, as a homeopath, we need to understand. We need to find out the cause of the problem in a deeper way. As we all homeopaths used to study each case in a case by case, rather than it's a case of thyroid or something like that. So when we find that what are the things that causes, as everybody says that it is the food, but actually food has nothing to do with, only some slight variation may happen if you take such and such food as. But actually, I am not giving any food restriction to my patients, because that won't do. And I don't find any much difference between. I didn't find any difference between whether giving these food restrictions or without food restrictions. So I never say that you don't take this or that, the carrot or something like that. But actually, still it works, because our treatment plan is on a different way. We are treating the person. So if at all a person cannot tolerate something, then that will also correct it. That is the technique, that is the way homeopathy is born to save the person or a patient. So that's the beauty of homeopathy. You need not to control everything in such a way. You can, of course, you can restrict something, but you need not to advise a patient you don't take that this like that. But frankly, when I studied almost all cases, I find what I found was that there are reasons other than food and nutrition, but the majority of cases, it is the mental stress and mental heart or mental depressions. All these are the things that causes thyroid problems rather than anything else. So I will narrate some of the stories of that this time, so that you can understand what really was the cause behind this. So let us begin the first case. Let me go to the first case here. As you all know, it's a case of thyroiditis. As you know, thyroiditis means the infection in the thyroid gland with the severe, since there is severe infection in the thyroid gland, there will be a rise of the colloids are getting bigger and bigger in size, and there will be the lymph glands also getting, since there is infection, naturally the lymph glands also may go to higher, may increase in size, and there also is there, since both these things together makes the thyroid gland in a big size. So this is what happens with thyroiditis. When you go for the thyroid function test, you can find that the TSH level, actually the TSH level is no, it should be, must be below 4, not 4.5 or something like that. But actually, when you in a thyroid cases, you can see in this thyroiditis and all those cases where you can find the thyroid TSH level is very, very high, where it may go up to 100 or 150 or so. So I have a case of thyroiditis with this increased level of TSH that is about, that is more than 100. So then I tried to, when the patient visited my clinic, she told me, it was a lady, a beautiful lady. She was an attractive person also. She is having, she is nearing her menopausal ages, that means about 45. And even though she looks in a beauty, looks like a very, very a good looking woman also. She's mother of some three. She's a mother of three girl, three. She has three daughters. All the three were married, and the symptom, present symptom was she was unable to sleep. Whenever she tried to sleep in the bed, she felt suffocation in the neck, so that she may have to get up frequently at night to see what is the reason behind it. So in order to get proper respiration, she need to sit up for a while, and then she again, whenever she started sleeping, then again suffocation start, and she may again get up. So this is the condition that she suffers, and she has another symptom there, which is none other than profuse sitting. She has a very high burning in her body, as if some hot water is flowing over her body. This profuse sweating, severe sweating was there, and these were also distressing for her to suffer. She would like to lie in a cold bath, for that also. But when I asked about the sexual life, what I got was that uh, she has mm, she was unable to have intercourse because her husband, whenever tried to have the sexual intercourse, the erection is not properly working, and because of that, she's not having sex for some 10 to 15 years. I mean, every time, whenever they try it, it become failure. So she has to suppress all these things because she was not. And she was not taking any medicine for that also, because he's not willing to go for that also. But without her knowledge, he has tried for some other medication, but it didn't work for him. Only very rare occasions they have the same. So they used to sleep in a different rooms also because of this. So and this was the reason. These are some of the reasons. And she was a very active woman. She was working as a fund collector for some organization, and she's also having a very good income from that, and she's one of the breadwinner for the family also. So these are the symptoms on which you have to prescribe. As you all know, what are the prominent aspects you have to consider in this case is that the patient is having at the age of menopause. So that is the first thing you have to note. Then suppressing their desire, and she was not able to have proper sexual relationship also. So there was profuse sitting on her. There were profuse sitting and suffocation, aggravation. That is, it is getting worse in the sleep during. So she has to get, once she starts sleeping, she may have the first sleep in a good way, and later she has to get up every now and then. So that is our remedy. I don't think that one need to repertoire the case, because you have the clear picture of the case in front of you, and that really it really was none other than the lachesis, which really works here. As you all know, it is a remedy of night aggravation, and it has profuse aggravation. It desires cold things. It likes to have all these things, and so I have to take since there is mental as well as physical symptoms corresponding in a good way. I took one potency as a potency for her, and it really works wonderfully. And when after some 1 year or so, when we check when she checked the TSH level, it is 2.6. So it is the beauty of homeopathy. It really works because you have to take these symptoms in a beauty. That's the how a homeopathy doctor used to sit in front of a patient and find out the real cause behind the illness, and rather than the prejudice causes. You have to throw away all those misprejudice ideas that thyroid is caused by this so and so, but actually it is not so. It is the person's problems that really makes a person a patient, and the patient, that's the reason why the patient comes to you, and it is not because of the organ, it is because of the circumstances, it is because of the changes happening in her body, it is because of the sleeplessness and everything. And as you know, the a person who couldn't have sex for so many time, and even having, as you know, menopause is one of the area where is usually it is better to have a good sexual interaction, so that this kind of problems can be arrested too. So this is the first case I would like to share with you. I hope you are able to follow me in that sense also. Hope, let me finish that case, Dr. Manoj.
Yes, yes, okay. Okay.
And let us go for another case, another story. This is a different one. A young woman for 21 years. She was married to a very high class person. She was from a poor family. Her father was working as a night watchman or as a security guard. So you can imagine how much of income they could generate from that. But she was a beautiful girl also, women also. So one boy from a higher level family came into this person's partner. And after marriage, what happened was she was confined in the home. She was never allowed to go anywhere else. And this person didn't care her, except he used to come at night and have a different type of sex with her, but never have. And he never inquired whether did you have your supper or did you have your lunch or what are the. He just considered this person as only as a sex partner and no other way. So that is one of the thing that she never have this thyroid problem before marriage or in her early life. She was a very talkative woman, and she was mingling with a lot of friends. She was having a lot of friends also. But these things are really, she was really hurt inside. She was confined in the room. She was not able to move from the home. She was not allowed to go to her own home also. So this was one of the thing that really hurt her, and when she came back her home after some 2.5 months, that means just in between in the third month, she came back to her home and told everything to her mother, that I won't go to that man's house anymore because he is not, he's only exploiting her for sexual purpose and no other way, no other thing must happen with her. So that was a case that you need to understand. And after reaching home, she was having sleeplessness, palpitation. She was having a lot of physical symptoms also. She was very tired. She could not even move away in a better way. She could not speak to anyone. She was so this ever smiling girl was become so reserved. She was so much reserved in her home, not mingling with her relatives also when everybody came to her. So this thing that this is how this girl was taken to a psychiatrist, and where they give some medicine and they checked thyroid gland. Then TSH level there was by her TSH level was something above 8.5, and after taking some medicines from there, she couldn't tolerate all those things. Then and no, not much. She was not getting much relief. So one of her relative told her to visit me to my clinic. She brought her to my clinic, and when I inquired, I found all those things in her. And so, as you all know, this is she told everything to me. Then even those things she never explained to even to the psychiatrist simply give medicines but not giving much counseling. But I just didn't give much counseling, but I just took the case in a beautiful way. She was open up with me and she told everything, including oral sex and like that. Everything she told, and that really, she told me, doctor, I don't want to go anymore to that home. So I would, then what is your idea, doctor? I told her better to divorce. So they took the decision to divorce and sent a notice for divorce. And after sometimes in between, I was able to treat her. As you all know, in this case, this is something that you have to think of. What are the things happen? She was a very good one, but she becomes reserved here. She was having love failure at her home, that from husband, and not only that, she was having a lot of mortification from her husband. It is nothing. It is something that we have to take note of. So I just go with the first remedy, but it is long continued also, long continued mortification, even from the very first day onwards. So she could, as you know, I was thinking about giving Ignitia first, but I thought it is better to go for Netromor because that is the. So I give hypertension. I usually give Netromor 1. I mean, in this kind of patients, and that really works on her. And after some 3 to 6 months, I found that it is gradually reducing. The TSH level is gradually reducing. She is feeling better, and she used to mingle with people also. Gradually, everything become a very good way. Then I advise her to think of a second marriage, and then she got a good person. I told her it is better to find you should. It is better for you to find your better half rather than your parents. So she find out a person from nearby, and even though they were not in a relationship before, they were just have the first relationship after this once she was coming to my clinic. She met this person on the way, and they talked for a long time, and that friendship really goes grown up into their marriage, and they married. And then I advise her to better. There is no need of medicine for because everything was fine in that during that time. Her thyroid level was also controlled, and then after some 3 months, she came to our clinic again for having an early pregnancy. So she wanted, doctor, I want to have a child as early as possible. Can you give some? Then I told it is better to wait for 1 year. And then if you are not getting a child in between, then only you need to go for medicine. But they told doctor, no, no, doctor, I don't want to face people. Everybody is asking me whether you got a child or like that. Why are you not getting pregnant? So everybody is complaining that she may be having some problem. So I told her, better wait, no problem. I shall give you some more medicine, and within 2 months, she was able to conceive, and now she is a 6-month old woman having 6-month pregnancy. Her 6 month of pregnancy is going on. No, no more medicine is. I am not advised to. I have advised her to stop all medicine, and she is now under consultation of a gynecologist. But still, there is no thyroid problems in her. I told her, if at all you feel any problem, you can have homeopathic medicine. I shall give you. But very recently they came because for a fever, as her husband got COVID-19, and I was able to treat her family also. His younger brother also got to this COVID, and I was totally cured with the homeopathy. She didn't have this cover or COVID, just only a slight fever happened to her. That is the second case I have shared for you and this night. Hope I shall go for one more case.
Yes, doc, of course.
Yes, yes. This is a case of a thyroid in a family. The mother, a woman of about 45, having two daughters. Now one is married, and the other one is not married, but she's undertaking her studies at that time. And the first came was the elder daughter. She came to my clinic after marriage, and they didn't have a child at that time. And doctor, I have this thyroid, because she was working as a nurse. So she she had checked the thyroid TSH level, and they told that you need to take this medicine thyroxine 25 to 50 regularly, so that you will feel better like that. She came to my clinic, and when I inquired about the case, what I found was everything started after the death of her father. He was a very energetic person, very lovely person, a caring, having very good relationship with her, with his daughters. So he was died on an accident, by a bike accident. So that was the shock. That was the first shock this girl faced in her life. So that she was unable to sleep for a long time, after the death of her father, and that was the reason for. So that we got the clue on that case, ailments after shock. So actually, here you can think of some of the remedies, but here I just give her one medicine. I go is Ignitia Valam, and then I have given another medicine, Arnica too, because there were these are the two things that works in these conditions. Really, I was able to take her in a good condition within some 5 to 6 months. Thereafter, some 6 to 7 months later, her younger sister also came to me with the same complaint. She was also having this hypothyroidism. I need not to go for much case taking, because I know that reason behind this. She also developed these things gradually. She did never have this problem before. She was also while studying. She was having no problem with her studies or anything. But everything happened after this, and that was also case. But here. The same medicine I have to continue to her also, and she was also feeling better, and she got a job also. And after 1 year, 1.5 years, their mother came to with the same complaint. She was nearing her menopause, and she was having menstrual irregularities, and everything was there, but this hypothyroidism was also there. So in that case also we can treat. So that means all these crises were happened because of the sudden shock that happened in her life, because no one can. They were having a beautiful family life. They were having a very good family life with their father, because he is such a lovely person. He never used to go for alcohol or anything, but he spent most of his time with his daughters and her wife and his wife. They used to go for all festivals. They used to go for picnic and everything together. So they once everything lost, then they have to no way to think in such a way. So these are the tragedies that really makes a person a hypothyroidic patient like so. I think that is all in the family were affected. It is not the mistake they are what they are taking in the common water. It is not the mistake of their water or something, but if these so-called research people may say that it is because of the bad water they are taking. So they are conducting their research work and say that, oh, the iodine content in your water is so much and so much high and also so much low. It may be the reason. It is the reason like that. But frankly, those people staying nearby having no problem with this. They are also taking the same water and they are having no problem. They are having same. They are taking the same food as these people, but they are also having. So this means that the psychological impact on a body, on a person's mind, is one of the biggest problem for is diseases, and this is how we as homeopaths need to look into. We as homeopaths usually take this case, whether Dr. Manoj, Dr. Hebert, or somebody else also, or Dr. Mariamma, whatever person who take this case, definitely think in that way. So that's the reason why people used to say, oh, you homeopathy doctors have so many patients because you have patient. Yes, we have patients because Dr. Hanim, it is not because of Dr. Dhanesh credit or Dr. Manoj's credit, but because Dr. Hahnemann has mentioned how beautifully you need to interact with your patient. You just simply sit there and watch and observe, listen, what the patient is telling or what the patient is showing, what the patient is expressing, and what the patient is not expressing, like that. So that will definitely end up with, that's the reason why most of the homeopathy doctors are spending a lot of time with patients. And this is one of the you people are doing more counseling rather than case your medicines are, it is not because of your medicine, because of your counseling. No, absolutely it is no. It is because of our, not because of our counseling. Actually, homeopathic medicines are super counselors. They really work more than that. And it is counseling you cannot give counseling to all persons. Or we know that some people may run away from your home if you start advising them, because they're getting advices from people around them. Even they are getting advices from even doctors also. Hey, you man, you have no problem. It is only your feeling like that. You just you need not take any medicine like that. But they have the problem, they want medicine. And so in those cases, if you start giving advices, they may run away from your clinic and without medication. So in those cases, really it is the medicine that gives the proper counseling. So that's the reason why I have written an article, homeopathic medicines are super counselors. Yes, I must say homeopathy medicines are super counselors. What's the time, Dr. Manoj? Whether we should stop, I should stop here or shall continue or something? I think it is better to have for a discussion. What's it? Whether
Yes,
time?
Yes,
If
doctor.
at all time, then we will go. I shall share some more cases because
Okay, okay.
a lot of people
Yes,
are here, so that you people can also share your experience here, and you people can also say what is your and knowledge on this type of or your interaction with the patients like that.
okay.
This is my the memories. That's the reason why I just told this. I have never not even time to prepare myself for this. I just saying everything from memories because once you sit a long time with your patients, definitely it will be there in your mind as memories. So that's the reason why I have given the
Yes,
subject memories. Thank you everyone for patient hearing.
yes. It is time for go to the discussions, and those who are like to participate, please go to the participant list and raise your hand. Meanwhile, I think a few points are to be considered. This is very much similar to the lesser writings of Kent, where he says a lot of questions, a lot of conditions without some technical, without any technical words, simple description. That is the peculiar to homeopathy, because we are all following that method. It is still capable of following homeopathic medicine, using homeopathic medicine. If at the same time, what will happen? Any man use the pathological terms and the pathological things of that time, we cannot use the material medica. But the sensations are there. After, even after 200 years, it's the same, no difference. The emotions are there. The death of a near one person, or now husband or wife or child, always causing symptoms or grief or vexations or fright or mental shock. Even in this in the Germany or India in 1800 or 2020 or in another after 500 years, there will be no change. Then I think the lesson writings are very important in the reading of physicians. The Herman's lesson writings will give a lot of insight in the homeopathy, how it developed. Then I think the lesson writings where the preventive medicine aspect, Harryman on describe on about the scarlet fever, where the Semtras kept the clothing in a room where a child was affected with this scarlet fever, and the mother took this stress from that part, the beddings from that part, and used for her child. Then the child got infection. So that's very important. So this part is in fact initiated by homeopathy, but unfortunately hijacked by allopathy. They are always saying that the hygiene part or the preventive medicine is their own, but it is our own. The part of homeopathy. The front of it is there. We can read. Everyone said the majority of diseases are transformed, infected by physicians. By with their hand, they examine one patient and go to another patient in a fashion-like manner. They always become contagious from patient to patient. Then another thing is the infection is often transferred through hair. So the physician must cover their hair and examine the patient. That's an advice given by Hahnemann. The importance of fresh air, sunlight, the morning walk, all these are given by Hahnemann. So that aspects are described in lesser writings. Just like the Bonius and lesser writings are wonderful work. Then the Farrington's lesser writings. These are very important. This is the reading of therapeutics by Nash, Clark. Then Dr. Prominent Burnett. That's very important. Now, listeners, those who would like to participate, please go to the participant list and raise your hands. Then, Dr. Dhanesh, I think the dietary regimen is very important. Then, why we are always giving counseling to modify? For modify what? The diet of the patient, so that will help the patient. So the mental problems of the patient, that will definitely clear the way. Just like that, the diet, so many things often acting as stimulants, goitrogens there. We know the cauliflower, the carrot, because all these plants are cultivated or growing in a hilly area where the iodine content is less, comparatively less. So when the patient is taking that food, naturally their thyroid gland will be stimulated. It's called goitrogenics. So I think there is no need of hesitating to advise a patient to follow these methods. Especially Hahnemann, after an extensive study about the coffee, there is an essay on Messeretics, the effect of coffee. And he said, at first I thought it was not necessary, but after doing some extensive work, I realized that it is a must. If you have any doubt, you can prove it yourself. No doubt. Coffee is an important thing that will always disturb the medicine. Hahnemann says it always disturb the medicine. It may endure, or it may aggravate, or it may alter. Three conditions are set in our 259 footnote. Very important. What is the opinion of Dhanesh on that? The diet and immunity.
Yes, a diet and regimen need to be adjusted if the patient is not getting proper result. If you find that the person is not improving after your right remedy, then you can think of the obstacles. There are certain obstacles in the way of cure, and if you find that these things are some of the, then you inquire about whether you are coming from. You sometimes they may tell that I am from Idiki, where I was to stay in a high range. I was to stay, my house was a high range area. So I was married to this area, and things started thereafter. So you can think of that. That may be the obstacle. So you can advise that it is better to avoid those food items where growing in those areas may be avoided. But in all other cases may not be worse, because we people are living in a high in the coastal area where everything is full. We are having we as Kerala people are used taking a fish as one of their they are spending lot of money for this fish. As you know, you can see lot of fish vendors everywhere on the roadside selling fishes as if they are selling rice. So that is one of the things that that is the only time when I interfere with my patients' diet. Otherwise, I allow them to continue. But in acute allergy conditions, where I found that the dry, oily food substance make more problems to
Yes,
patients.
definitely, doctor. Then I think there is, we must be cautious about the diet of the patient after taking some medicine. I know once a patient, I gave him the lycopodium tenum. Then I advise him not to take the shellfish with like prawns. But what happened? Unfortunately, the patient once he was treated in a hotel, restaurant, somebody gave him, he just forget about that, took that medicine. The prawn, right prawn. Suddenly he developed the severe angina or edema. He had to take the hospital. Then another example, I know that one person with severe headache, his migraine was there, he was given with argent and nitric antenna. And he took the pastry. Within half an hour, he developed severe headache. So this is the way homeopathic medicines are proved. So we don't be ignorant of that. I think we must prove. Then again, just we giving arsenic alum as preventive medicine. Definitely, we should interdict the patient. Don't take the cold food, because always chilling the stomach will aggravate the arsenic condition. What happens if you take arsenic album? Your system will be converted to an arsenic stage, development of symptoms. Naturally, that is how we are proving the medicine. So
Yes,
I
exactly.
think that is very important.
Exactly. That's the reason why there is a chapter in our repertory itself, and where you can say disorders and aversions as well as those things aggravate. If you the lemon aggravate, salt aggravate, the meat aggravate. For example, graphite is the meat. Though a patient likes meat, but used to take meat aggravate, but
Yes,
salt aggravate.
yes,
There is also an amelioration from salt also,
yes.
like that.
For example, another case, if you take guanine, then if you expose to severe sunlight, definitely you will aggravate the headache. Dr. Nash challenges those who are not believing homeopathy. If you are have enough courage, take a few drops of guanine in an ounce of water, then drink it and go to the direct sunlight. Within 15 or 30 minutes, you develop severe headache. So that is the importance of homeopathy. Then I think that Ken say describe about Gronine. They are always carrying an umbrella with him. You can identify a Gronine patient. If he is always carrying an umbrella with him, it definitely is a Gronine patient. That much sensitivity is there. That sensitivity can be converted, capitalized for homeopathy prescription.
Exactly.
That's
I
very
think Dr. Paridvav, Sri Paridvav can want to speak.
yes, sir. Yes, they are waiting for yes, sir.
Yeah. Good evening.
Good evening.
Am I audible?
Yes,
Yes.
sir.
Congratulations, Dr. Dhanesh. As used to be, you have made an excellent presentation. Supplement by Dr. Manoj. Both of you have performed well in a simple way, and every layman can understand what you have been trying to say. It is a problem. Actually, nowadays, most of the people, about I think more than 30% of the people, especially in Kerala, are suffering from thyroid problems. Thyroid issue or problem is affecting our functions. Most of the body functions are being affected, impacted negatively. Uh, I would like to ask a simple question that what are the major functions being affected by the disorder of the thyroid function? Could you please elucidate this in a simple way, please?
It definitely the function thyroid function when it is disturbed, it will affect almost all part of your body. For the first symptom you may feel is laziness, dullness, then you may feel heaviness in your body, your fears, fat is increasing, your size is increasing. But there is the contradiction also. The same is there are different type of things. The same also the person may become slimmer and slimmer, getting slimming like that, become leaning. Their fat may lose also. So these are some of the area. Then as far as these menstrual disorders, a lot of menstrual suppression of menses, excess of menses, there's menorrhagia. We used to say that frequent menstruation may happen. There may be delayed, sometimes 2 months or some 6 months gap in between menses. That may affect. Then definitely there is palpitation. That means heartbeat may be. You may feel difficulty in walking while your heart may you feel about your heart when while walking. That is a technical term we used to say a palpitation like that. And sometimes there may be edema. That means swelling in your body. These are there may be heavier hair fall. This is one of the area where homeopathy doctors are getting a lot of patients, because once a patient's hair you lose your hair, definitely they think about, they may come to your clinic, doctor, I am losing, I have no other disease, I have not taken anything else, but still I am taking pure water from our well, but still my hair is losing, I am losing a lot of hair. I cannot even go for functions because of this hair loss. I was having so this much of hair touching my back and buttock like that, but still you see there is no much like that. That is also one of the biggest problem from thyroid gland. Of course, thyroid is one of the gland that really control your temper, and of course, thyroid is also having. It may disturb your sleep. You may not have it. So physical as well as mental symptoms. A lot of symptoms may arise because of the thyroid problems in a different way. So I have not, I have shown some of the cases, and the anxiety is one of the other thing also. I think
Yeah, you have answered well. Another simple question is that what is the relative proportion of men and women affected by male and female under this particular
it is
disease? How you
yes,
have
thyroid
you
disease,
observed from your
yes, yes,
clinical observation and all that?
it's more than when we compare, it is more than 80% of the cases it affects women. Only 10 to 20% are men get this disease. That is one of the things that we used to say that ladies suffer more mental problems rather than men. Men have some other way to relax. They may go for some drinking, or even they may go for some other cigarette or something, or sometimes they may scold somebody, or sometimes they may mingle with some parties or something. But ladies are confined in their home, and they are not able to do all those things just like men. That may be the reason why this thing is happening more in women.
Yes, yes, thank you.
They have more
Is there any
responsibility.
age factor? This age factor?
Yeah, the age factor is more during these teenage level to these up to 30, 40. Then thereafter menopausal age, that is about some 40 to 55 to like that. Thereafter there may usually people don't get thyroid problems after 60 or something like that, but usually it came before that.
Okay, thank you, thank you, thank you.
Yes, doctor. Now, Dr. Anand Deswal. Dr. Anand Deswal, please unmute. Yes. Dr. Anand Deswal. Okay, right.
Good evening, sir.
Good evening.
Good evening. May I audible?
Yes.
May I audible?
Yes, yes, I can hear.
It's a very wonderful presentation, sir. Thanks to Dr. Manoj. Very unique things I learned from you. I have a question regarding the case. A patient come to me, their TSS level is 15.6. After homeopathic treatment, their TSS level is 13.6. Their symptom is gone. They come with me body ache, weakness. After that, patient again compelled to the same complaints regarding weakness, lethargy. Shall I go for treatment? Otherwise, I refer.
What is her hey,
Yes,
what, whether she is whether the person is a woman or a man, and what is the
woman, sir. Woman, 30
but
years of age.
that means she is having. Have you inquired about her relationship in family? Whether is there any problem in the family, or whether there is any problem with the husband, or whether the husband is having any other relationship, or she is having any other relationship? Whether she had any love affair in the early times, or is there any death of her child, or anything like that, or is there one? Is there in-laws used to modify her or like that? Have you inquired
Sir,
about all those things?
no, sir. Actually, they always come with husbands.
Uh,
That's why she's
this
not
is
comfortable to disclose all things.
that itself is an idea. Then what you need to do is you just ask her to go outside, and then first you should sit up with her husband, and simply talk for some time, and thereafter then you just ask him to go out, and then let her to come. So that will definitely then she will open up. The thing is that if you ask her to sit you for the first time,
Yeah.
definitely he may not be interested in that, so
Yes.
he may
Yes.
take her away. So first, what you have to do is you just make talk with him, and then later only you should talk to her. That itself is a clear case of Netamur, I think, because that is that's the reason why she is not open up in front of. She want to talk something to you. She want to convey something to you, but it is you are not able to find out the reason of that. That is the reason why it is still on 13.5. So
Okay.
you just
Okay.
you never direct the patient, but you just
Hello.
ask her to come to your clinic, or even if possible, you should ask her to call you privately so that you can understand the reason.
Hello.
Okay, Dr. Anand Jaiswal, this is better to go to the handyman's instruction on a case taking. Okay. Now, Dr. Hariharan, please. Yeah. Yes.
Doctor, so I heard Anand Jaiswal's complaint. I think it's so better to examine the TPU. Then only we will understand the real picture of the thyroid. Can you hear me?
Yes.
See, in TPO cases, this type of cases I have seen, and we can easily manage it. You know what is TPO?
Yes.
TPO is that it is an antibody against thyroid. We can examine the TPO and find out any antibody against this thyroid. So such cases, whatever the medicine we give, we give, the TSH will not come down. We must go through that and then give the exact medicine along with the carcinosin. The TPO will come down and patient will be cured. That is the way. So can you hear me?
Yes,
Yes.
yes.
Yes. Yeah, okay.
You rightly told.
So-
Just
so
like
each-
it has
so-
many treatment like that.
See, each and every thyroid case, along with the T3, T4, TSH, you must examine the TPO also.
Okay.
TPO also. We do not ignore that point.
Yes. Yes.
See, if the TPO is there, it will not come down. So that is, I think, last question's answer is that you tell Anand Jaiswal that examine the TPU and find out the reason and give the line of treatment in such a way that the TPO will come down. And I have a lot of cases like that, so that I am saying so.
Yes, doctor, then why don't you have presented in the IFPH? You can have presentation, doctor. Okay.
We are having lot of problem in getting faculties nowadays. But I have requested Dr. Hariharan to come forward with the.
No. See,
Why
sorry,
not?
I am not prepared to take class. I can say supplement. I can supplement my knowledge. Now, in thyroid cases, my line of treatment is that, see, you take the, whatever may be the reason, you take it, you take the constitution first, patient constitution first. See, this is what Dhanesh narrated the cases. They are all psychosomatic derangements.
Okay.
See,
Yes.
above all, there is constitutional derangement is also.
Okay, doctor, thank you. Now, yes. Now we have to finish from at 9 o'clock. Dr. Abraham, wait a minute.
Okay.
Yes, Dr. Abraham.
Hello, Dr. Hariharan is very, he can take very excellent classes. I remember that 20 years back, he took a class in for medical officers. At that time, I couldn't understand it. Very high standard classes that. So, Dr. Hariharan, Dr. Hariharan, please take one class for us. This is very beneficial, maybe very beneficial.
Yes, our Farid Bagan, sir. I think we can have. I know
One
the
more
son with
person,
a
sir.
vote of thanks, Madam Farid Bagan, sir.
Hey,
Please.
Dr.
Yeah, yeah.
Graham here.
Okay, thank you. Thank you.
And-
Anyhow, Dr. Hariharan, yes,
Farid
made an
Bagan, sir.
excellent and relevant point. We
Please
want
wait.
to have details on that. Very relevant point is
Farid
TPO.
Bagan, sir. Please
Yeah,
wait.
yeah.
One more person. And Dr. Graham is willing
Yeah,
to.
okay. So,
Hello, how are you?
Hello, you can speak, Dr. Graham.
Yes.
Get me? Hello,
Yeah.
Hello.
Yes. Come on.
can everyone hear me?
Yes.
Yes, I'm really sorry. I've not been. I've been busy with the exams and school. I would like to appreciate to come back again. Thank you, thank you. I'm so glad. I'm from Kenya.
Okay.
Yes. Good.
Yes.
Thank you.
Now Farid Bagan, sir. Please, a vote of
yeah.
thanks.
I- okay. It is my privilege to express gratitude to both of you. Actually, made an excellent presentation. As I pointed out, the point raised by Dr. Hariharan is a very relevant one, and we want to have another session on that particular point at least. May I express my gratitude from the bottom of my heart to both of you and all who have participated in this, the bank talk, which is excellent and eminent. Thank you very much. All the best. Good night.
Yes. Okay. Well, that was the end of today's session. Day 4 to 3. We shall be back again tomorrow with the same day, a different topic. Till then, goodbye. I need to over to our Malayalam session. So, our participant in Malayalam session can also continue. Thank you. Now, Dr. Dhanesh, who is the host of our Malayalam session? Are you or Dr. Ranjeev? Who is the host?
Dr. Ranjeev is not here now, I think.
Enjoy. Yes. I think you can proceed on. Yes. All to you.
Namaskaram.